Welcome to Girl Talk here at Bajaj Plastic Surgery. I'm with Dr. Anu Bajaj, board certified plastic surgeon. I'm Connie, her patient consultant. We were having a conversation recently about social media famous doctors and the type of content that they post. And
so this is what concerns me is a lot of doctors have huge social media followings, but that doesn't always translate to being a good doctor or a good surgeon.
Right.
And so I think patients assume that if you're social media famous, that you're a good surgeon. But I don't think that's always true.
And that could be true. I mean, if you think about any industry, people have talents. And just because you're good at, like, you have this really good skill and you're very talented at this thing doesn't mean you're always great on camera or great at doing, have the energy for those things.
That is so true. Like, some of the smartest people don't have a stage presence, but that doesn't make them not smart.
Right. And some people who have amazing stage presence would be terrible in the operating room. So, okay, so then are we finding, are these people outliers? Are they anomalies that they have both? Or should we question? Should we just be curious?
I think patients need to do their due diligence and be curious, because they're different components to being a good doctor or a good surgeon.
Okay, what are some of those?
So, first of all, there's the paper stuff, like having a good training background, right? We know that you need to make sure that they've done appropriate residency training, that they've achieved board certification, that they do their maintenance of certification. Yeah. And that they have privileges at a hospital to do the same procedures they're talking about doing in their operating room.
That's a good point. Because I do have people ask that. They say, what hospital is she affiliated with? And then I have to say, she has privileges at St. Anthony's, but you have to have privileges at you have to have hospital privileges in order to have private. How does that work?
So basically, as a surgeon, especially in the state of Oklahoma, you can pretty much do anything you want in your office, right? Because you're the one that's in charge of your office.
Okay. And you hold the liability.
You vet yourself, right?
Okay.
But when you apply for privileges at a hospital, that credentialing committee at that hospital reviews your board certification, your medical school history, your lawsuit history, and your case logs from your training, and even current case logs. And so they vet you as to what you are allowed to do in that hospital. So from a patient perspective, if you know that your surgeon has the privileges to do the same procedures that he or she is doing on you in their office-based operating room at a hospital, you know that hospital has vetted their credentials.
All right, great. So you've got the components that make a good surgeon or a good doctor.
Well, so that's one of the components. That's the paper stuff.
Some of the paper stuff.
Sorry, I didn't mean to interrupt you.
No, this is what we got to be able to talk on top of each other. And it's just how it's going to work.
So one is the paper stuff.
Mm-hmm.
The other thing is obviously the bedside manner, the friendliness, which is something that you are the only person who can judge, because I may hit it off with one patient and not another, or vice versa. So you have to figure out the surgeon that connects with you. And that may not always be the social media famous. Like, your friend may like a different surgeon than you do.
Yeah.
So that's one.
Personality types.
Personality
and
matching.
Compatibility. Almost like compatibility.
No, but it is compatibility.
Compatibility is very important. I agree.
And the other thing is surgical skill, right? Just like you mentioned, some people have unique talents. I do think surgery is also a talent. Some people are really good with their hands, and they're very good in the operating room. And to be honest, I've seen fantastic surgeons with amazing skill sets in the operating room who don't have the best bedside manner. But if I wanted somebody cutting on me, I'd take the surgical skill.
You would still take the surgical skill. Yeah, right. And I remember one time you saying, when you were doing the deep flaps and everything, you're like sewing tiny blood vessels and operating under a microscope, and you're like, I think I'm pretty good at this. Like, this is something.
I loved doing deep flaps. Doing the microvascular anastomosis to me was just very therapeutic. And I used to say that sewing on little tiny blood vessels was my talent. Standing still for 8 to 10 hours at a time and being 100% focused was and is my talent.
Yeah, that would be torture for some people. But so you can have, but there are going to be surgeons with all different skill levels too. Correct. In that range. And there will be someone who's trying to do that and they're just frustrated and they're like, this isn't what, because there's all types of surgery.
Or there are people that you can watch in the operating room and it's like watching a well choreographed dance.
Oh.
Or it can be like watching somebody who just has 2 left feet.
There you go.
So how do you figure out?
Okay, yeah. How do you figure out if they're a good doctor?
So to figure out who's got the well choreographed dance in the operating room is tricky because as a patient, it's not like you can go into the operating room.
Yeah, we can't compare.
But I do think that people who work in the healthcare setting, for example, nurses who are in the operating room, anesthesiologists, other doctors, scrubs, when they work with the surgeon day in and day out, they know which surgeons are good.
Mm-hmm.
So that's one way, is if you know people in healthcare, ask who they would recommend.
Oh, perfect. Yeah, that's a great resource.
And what other?
I think the main thing is just that you're not relying solely on the fact that because they are creating a lot of content and that they are social media famous and they have this extreme amount of views, that should not be your key indicator that they're good in the operating room.
That shouldn't be the only thing you look at.
Right.
It's a very difficult process to find the right surgeon, but I don't think the number of followers necessarily is the best answer.
Right. But you can follow our social media because we're pretty good at all of the things. I mean, we're trying, right? So let's talk about, actually, I really like this as a podcast, just sticking with the social media famous people. Buzzwords, right?
Right.
Social media people, they're using the buzzwords, and then when people call us and they're doing buzzwords.
So one of the things that people try to use to set themselves apart is to use buzzwords, right? So in each area of expertise, there's a certain buzzword. For faces, it's been deep plane facelift. For liposuction, it's
laser assist, or what are they asking?
Laser
lipo. Or what are they? Yeah, they're doing.
What are some of the other buzzwords they tell you about?
Gosh, I don't know, because I go, we don't, just let's get the right procedure, because that's.
Or like my favorite is on the ads for one of the places, you hear the micro laser technology with regards to liposuction. Yeah. I want to say, what are you talking about?
Right.
There's no such thing.
Rapid recovery. There's the whole rapid recovery for breast dogs. You can be back to doing, and the less downtime.
Yes.
And we've been doing that. Like as women, we want you to have the less amount of downtime, like that we can possibly. You can't keep me down. I'm going to be back to doing
you got kids to take care of. You got to go to practice or take somebody to practice.
So instead of trying to put restrictions on people, let's go ahead and empower that, because they're going to do it anyway, right? So we need to be able to help them with that. So we're like, okay, well, fine. We'll call it rapid recovery if that's what you want to call it. But
as a patient, then when you hear these buzzwords, I would say approach them with a grain of salt, to be honest. And another important thing to consider is when a social media famous surgeon talks about a specific procedure and they say it's their special procedure or that it's their patented procedure, I would definitely approach that with a grain of salt, because one key factor with being a plastic surgeon certified by the American Board of Plastic Surgery and member of the American Society of Plastic Surgeons is it states clearly in our code of ethics that we cannot patent procedures. Because as physicians, if there truly is something that's good for all patients, we need to share that knowledge.
Right, yeah. And that's the being curious, right? I think you're in a specialty where that you're giving up the ability to patent things and be a gatekeeper. It should all be for the benefit of the patient.
It's exactly why we do what we do. That's why you go to medical school.
Yeah. And also, going back on that, when you are seeing the things on social media and you're like, okay, I want that. Deep plane facelift. I saw this lady's results on that. Now I want it. So I'm going to call up Bajaj Plastic Surgery and be like, okay, so I want my deep plane facelift because it looked good on her. It should look good on me.
I don't think that's always true. Everybody's different. What you do for one friend, what your friend had may not be the right answer for you.
Right.
Because your anatomy is different, your medical situation is different. And so that's why when you talk to your surgeon, you need to talk about what your goals are as opposed to dictating, look, I want what she had.
Mm-hmm. But we've seen this just even in our own practice when people start to do things and then they talk about it, then their friend calls and the next friend calls, and before you know it, you kind of have a gaggle of them. But I think they've done, like the groups that we've had have done really well at listening and kind of understanding their own unique anatomy. And they've seen it firsthand that their friend's surgery was nothing like their surgery, Even if they're all getting breast surgeries, they still have their own unique experience because they're coming in with their own unique anatomy.
Right, which also means that they have different requirements. And so I do think it's important as a patient to remember that surgery is not like a menu item at a restaurant. When you go to the restaurant and you order off the menu, things are very uniform because they don't really change the recipe between you and me.
Yeah.
But surgery doesn't work that way.
If it did, here's what that would look like. They could just go to our website, click on the drop-down box, and order a facelift. And then go put it in the cart, and you check out, right? And then you show up and you're like, here's my receipt. I'm going in for my facelift. Like, it's not a drop-down box. Nothing is cookie cutter. It has to be, you're over here like touching people's faces and touching their stuff. Like, what is their elasticity? What is their
skin quality?
This whole pinching of the skin thing that you do. What? I don't know. Well, now you have to explain it because people are going to...
as we age, our skin loses elasticity. It's a natural process that starts to occur in our 30s and gets accelerated during menopause and perimenopause. It also happens during weight loss. And with weight loss, you have to think of that rubber band that you've stretched out so much and now it won't go back to its original shape. Instead, you just have loose skin. And so when we're talking about surgical results, the quality of your skin plays a huge role. And that's true for facelifts, that's true for breast surgery and body contouring surgery. So that's why plastic surgeons will pinch your skin.
And even though we think that we're so much like our friends, right? Because we could all be like, oh, well, we're all moms and that we all have teenagers and we've all been through the breastfeeding, we've all been through... So we think we're in the same, even if we're in the same demographic, it doesn't make our skin quality or tissue quality, it doesn't make us the same.
Absolutely not. Genetics also play a role, I have to say.
Oh, huge. Yes. So, but these social media doctors, I feel like one of the things that drives me kind of crazy is the on the table results. And I know that we're just trying to get like, maybe they're just trying to show a sneak peek into the process. But I still think you need to show the true results, right? And on the table result.
So I would
translate
it's one of my pet peeves, right?
Because maybe that's why it bothers me. It's because what bothers you bothers me.
Because results, when you're seeing an on the table result, you're seeing one short snapshot. You're not seeing how that process evolves over the next 3 to 6 months. And I think that gives all of us unrealistic expectations, right? Because when you see the on-table result and compare it to the before, it's really dramatic.
Of course.
But why is it different, right?
Yeah.
On the table, there's no effect of gravity because the patient's lying down. So try taking a picture of yourself lying down and see. You'll probably look better with regards to some things because there's no gravity.
Yeah. So we want to see that we want to see the follow-up. Nobody comes in for a follow-up appointment and lays down either.
True. The other thing that happens with surgery is part of the healing process is swelling. And that occurs from surgery for about 2 to 3 weeks. You'll see a huge amount of swelling, which will decrease, but you'll continue to see swelling go down for the next 3 to 6 months. And that also impacts the results.
Yeah. And again, with the face example, if you're swollen, oh, there went your nasolabial fold, there goes your marionette lines, there goes all of this.
Every little wrinkle is now filled with water because it's swollen. And so it's smooth.
We also, like, at first we're like, I need this swelling to go down because you can barely see, like, everything's all swollen. You're like, you want the swelling to go down. And then as it's going down and everything looks like just nice and full and glowing because you're pulled tight. And then as that starts to go down, it's like, oh, things are settling.
That's true.
It's such a process and it's so hard. We see it every day with patients being anxious or curious about what is it going to look like at the end, what to expect, because I see this today, what's going to stay and what's going to go. And you just have to trust the process.
You have to trust the process. So I would say effects of gravity, effects of swelling. The other thing that we don't always see with those immediate results is movement. How does your body move after surgery, right? Because even with like a facelift, the key would be natural movement.
I think so. I think what we want is kind of natural results. I don't want to look like someone else. I don't want to look freaky. I don't want to look too pulled tight. I don't want to look, and I'm not trying to tell everybody what they should want, but I think more of the demographic and the aesthetic that we go for is you, but improved, and like turn back the clock a little bit. Just these things versus looking.
Yeah, surgery's not going to change who you are, but the goal is always to improve you and enhance your own being, right? It's not going to change you. It's not going to give you somebody else's body, but it's always about improvement and enhancement.
Yeah, and that if that thing that you wake up every day and it's bothering you when you get dressed or when you're putting on your makeup then if that changing that and improving that is going to give you more confidence and a little more, it's going to affect your daily quality of life.
Exactly.
And that's what we're here to help with. So thanks for joining us today for this episode of our podcast, where confidence looks good on everybody.